Thanks for being along with us this morning on Good Day Stateline. Circle of Wellness offers many ways to help you feel better, and Dr. James Morgano is here to talk with us about one of those ways. Hi, Dr. James Morgano.
Yep, nice to meet you.
Nice to meet you. Thanks so much for coming to Good Day Stateline.
No problem.
So we've talked about a Circle of Wellness before.
Sure.
So many things offered over there, and this one is very interesting. Thermal imaging. Can you tell us about what thermal imaging is?
Well, thermal imaging is basically a picture you take of the body. It's kind of not like an x-ray, but it gives us more information about heat or increased blood flow at different areas of the body, and it gives us a good idea of where the inflammation might be, where there might be a potential injury, and then we use this as setting up our treatment plans because we want to see the patients improve. It really hones in on actually where the pain is starting from. And we've had this now for about 3 weeks, and it is wonderful. But it kind of gives you a visual picture of where the pain is at in their body.
And so that helps you just realize where you should treat it, right?
Correct, because oftentimes we may be missing it. And so we'll take the thermal picture, it will show maybe a trigger point or a myofascial point or something that was outside of where we thought the pain might be coming from, and it has really improved our patient outcome.
And what type of imaging, what does this type of imaging do?
Well, what it does is basically looking at the skin for any increase in temperature. And typically an increase in temperature is related to something not normal. It could be an inflammatory process. It could have been an injury. I do this quite a bit on my personal injury practice. It can even be a pathology that might be happening in the body as well that hasn't quite surfaced yet. So it really gives you a good idea whether there's something kind of there that might be brewing that hasn't come to fruition yet. So
like a map.
Correct, it is.
And you can see the pain.
You can see where the inflammation is, and then that's where most likely the pain will be.
And that's different than obviously an x-ray for a lot of reasons, but you wouldn't be able to see those like heat sensors.
Correct. We
on
get a
an
lot of
X-ray.
patients that come to our office for massage therapy services or physical therapy services that don't need an x-ray. They may have a chiropractor that they see for that service, and we don't have to, there's no radiation with this machine.
Right.
It's just looking at a thermal image of your body, and it works well for patients that don't want to get an x-ray.
Yeah, you could just take millions of pictures of yourself all day. You're not going to be harming yourself.
Correct,
like
right.
Potentially too many
And that's
x-rays.
what's nice about it is that it can be done again if you wanted to reshoot a picture to see whether they were responding to care. You're not radiating them. It's non-invasive, and I think you're going to see more of it in the future in healthcare as well, hopefully.
And what body types or body parts or what ailments is this good for?
I do what's called a regional scan. So if a person comes in with a neck injury or a neck pain, we'll do a picture of the neck, and we'll also scan the arms because the nerves go down the arms. If they come with a lower back complaint, we would do a lower back x-ray and also include the legs. It's also being used for breast imaging, and that's really where I think it's going to be beneficial in the future.
It's always great to find another way to detect anything.
Well, what it does is it looks for physiological changes in breast health. And it's really meant for a younger woman years before they can get a mammogram that wants to start to track year to year breast health.
Well, and that's what they always say is to do as many checks as you can.
Right.
So this is a great...
And what's nice is this does not use radiation. For the breast health patient, they would come in and get an initial scan. They would come back in 90 days for a follow-up. If nothing has changed, that is their blueprint that they then use year to year to come back to see whether there's any changes. And typically, if you can pick up those changes early enough, they can be reversed with diet or with lifestyle changes.
Well, that sounds like a wonderful addition to
That's
Circle of
awesome.
Wellness. So we're gonna play with this thing now, right?
Sure.
So you brought it with you, which I think is awesome.
Sure.
Thanks
to
so
kind of
much.
give you an idea of how it works.
Yes.
It's not the perfect clinical situation.
Sure.
The room we have it in where we do it is temperature controlled. There's not lights that would heat it up.
Yeah,
so,
it's hot in
but
here.
it can kind of give you an idea of how it works, and we can maybe do a scan of your...
Yeah, so I have some minor jaw issues from my whole life. So did you want to try
Sure,
with
let
my
me
jaw?
go ahead then and
Okay.
I'll get it.
So you're going to get it
So
set
why
up
don't you go
there.
ahead then and just kind of face that way.
Okay.
And then
Oh,
is
face
it...
over here. I never
and
look
I'm
over
gonna
here.
need to turn this so that I can
Okay.
actually see and focus the camera.
Okay, so basically you have it on a stand as well at Circle of Wellness.
Yes, on a
so-
stand, and it's in a controlled environment where we can control the temperature, and
Right, because the temperature is what.
it wouldn't
what's
be
being
I
tracked.
wouldn't
Okay.
be moving it around.
I'm not going to
and-
look at you anymore.
There you
Do
go.
you want me to smile?
Why don't you pull your hair back slightly?
Okay.
There you go. Perfect.
Do I smile for this picture?
Sure. It'll pick up. One thing I noticed it picks up quite a bit on my patients is dental problems.
Okay, let's not
Stand real
find
still.
those.
I will not. Okay, stand real still. Okay. So I'll get an initial picture.
Okay.
Just kind of put it this way.
I look so groovy with my
go.
blue hair.
Then what you'll do is you'll kind of scale the colors down so that you've got some reds and some whites. Those are different heat temperatures.
Uh-huh. And it kind of looks like a weather map.
Yeah. So when I scroll it down, here it is, TMJ.
Whoa.
Right there. So you've got, I like to have just a little bit of white, just a little pixel of white, and then other colors blend in. But where the white picks up is right here.
Yeah.
So, and that can be treated at our office, massage therapy to the muscles. We do a cold laser at our office for inflammation. So that might be something that would benefit that as well. And it's nice because it shows patients. Sometimes patients come in and they're in pain and they just want something visual that kind of shows it. And it's a very accurate.
Incredibly accurate.
software.
And, sometimes we think things hurt, but that's not, it's residual pain from something else, so this would be a good way to show that.
And it will pick up like trigger points, and it'll pick up like myofascial pain, and it's kind of neat because it might pick up referred pain. It'll pick up like a pinched nerve. It'll show where the nerve is pinched in the neck might be more red or more hot, but the actual nerve that's being compressed shows up a little bit more blue. Yeah. So it really is an interesting piece of equipment.
Absolutely. So you have a lunch and learn coming up?
We have a lunch and learn coming up, June 8th.
Okay.
At Tavern on Clark.
Uh-huh.
I think it's noon to 3. You might know more than me.
It looks like it's 12:30 to 2.
Awesome.
So we'll be there right on time. You'll be early.
So, and we want to start to let the public know and let the community know that we have this service.
Oh, yeah.
And I'm excited.
Well, thank you so much for
Thank you
coming.
for
How
having
fun
me.
was that? Now when I tell people I have TMJ, I'm like,
You
I
can
really
come
do.
on in. Thank
It
you.
was so nice to meet you.
Great.
Thanks so much. Before we take a quick break, let's see what's going on around town.
Okay.